spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Aloha, happy Wednesday. Thank you so much for being here on Spotlight Hawaii. I'm Yunji Denise, joined by Ryan Kalei Suji. And Ryan, today we have a guest who joins us usually every month. I love speaking with her because this is an apolitical conversation. We just get straight to the data and straight to what's really happening on the ground with COVID.
That's right. We're going straight to the source. Joining us now, Department of Health Director, Dr. Libby Char, joining us. Thank you so much, Dr. Char, for being a part of the conversation here this morning. Always great to see you. Want to start off right off the top with the numbers that we saw today. 330 people, new infections that were reported in the state of Hawaii, but sadly 12 deaths. What can you tell us about what we're seeing overall right now with COVID in our community?
Good morning, everybody. Thanks for having me. So, our hospitalizations are still very high, but the COVID hospitalization rate is coming down. So we're very happy about that. We had 150 people hospitalized with COVID at the beginning of August, and we were as high as 400 people hospitalized going into the Labor Day weekend. So we were pretty concerned about that. And today we're down closer to the 275, 300 range. So we are trending downwards on the hospitalization. But if you look at the ICU beds, and that's really where we had the pinch point, we still have very, very high numbers of people in the ICU. COVID specifically, it's been 75 to 80 people in the ICU, and that's really been steady for the past week or 10 days, despite the rest of the overall hospital numbers coming down. So we're still very, very concerned and still watching that. And if you look at total ICU capacity, including COVID and non-COVID, we remain quite full in the ICUs. We're way up there, pretty close to the licensed adult beds. So we're by no means out of the woods, although it is nice to see the overall hospital COVID numbers trending downward. Still real tight on ICUs.
Yeah, I want you to delve a little bit deeper into that, because there is this feeling when we see the numbers like the ones in the last few days, they're certainly not low compared to what we were used to earlier in the summer, but we do see that downward trend. And so there is a feeling like, oh, we've turned a corner on this. What are your thoughts on that?
Yeah, I have a graph from the Johns Hopkins dashboard that I would love to share with you. I'll try and get it to you at some point. But it shows that we had a peak from about a year ago of COVID cases, and then we shut down. And then since then, we've hit this astronomical peak up here related to the Delta variant and just significant spread. So we've plateaued here, and we're actually starting to come down a little bit on the COVID numbers, but we're still way up here. And so while I'm encouraged to see us starting to trend down, I think we need to be really, really cautious. We're still way up here. Why would we want to open things up and have large gatherings and release restrictions when we're still so high? Because I would worry that we would then plateau at this point and never come back down to our baseline. And mind you that we're able to provide optimum health care for everybody, including in the ICUs and critical care patients. But that's with the use of 650 people from the mainland who are here helping staff our hospitals. And that's with the use of tents in front of all of the ICU, in front of the ERs, that are enhancing the emergency department capacity and our ability to triage people that are presenting for emergency care. Until recently, we had a lot of uncertainty about the amount of oxygen in our community, where our demand was exceeding our capacity to produce it locally. And there was even some concern for a while about the capacity of the mortuary beds. And so, thankfully, we seem to be stabilizing on many of those fronts, but we're by no means out of the woods. And I would say that if we could sit tight for another 4 weeks or so, we will probably be in a pretty good place. And I really commend Mayor Blangiardi. I know it was really difficult, but he's extending his his orders for the next 4 weeks to prohibit large gatherings. And I think that is really, really key. That's going to be so important for us. If we can be patient and sit tight for about 4 more weeks, we're going to be in a really good place.
One of the unfortunate things that we also are seeing is just a larger number of deaths being reported each day. And again, today was 12 deaths. But if you can speak through that process of how that is reported, if that is a direct correlation into what has happened recently, and how those deaths are accounted for and connected to COVID-19.
So if you look at a curve plotting the number of deaths that are reported on any given day, it lags the curve from when the cases are diagnosed, obviously. But again, it sort of matches where we had, that curve that went up a year ago and came down, and now we are way up here again in terms of the number of COVID-related deaths. If a lot is known about a person and the death certificate comes out with the cause and manner of death very quickly, because that person had a primary care physician that knew about them and knew about their history, and they were able to document well, that may get added to our case counts within a few days. However, if it's somebody who's unknown, or if there are other circumstances that they're trying to make sure that the cause of death wasn't related to something else and that it really was related to COVID, that can take a month, that can take longer than that. And so it will take that much longer. And until we know for sure on the death certificate that it was a COVID-related death, you're not going to see that in the counts. So there may be a lag as much as a month, maybe even a couple of months. And then also from the time you get COVID, there's a lag between that. And if you need to be in the hospital, that may be a week or so. And then from the time you're in the hospital, there may be a lag if you have a bad outcome and somebody were to die from it. So you can see where there could be some significant lag time.
Tony has a question here. He says, what is the baseline? You talked about that graph from Johns Hopkins, but and not wanting to plateau at this higher level. What is a case count that you are more comfortable with that could make us feel like we're in a good place? I know that you watch a number of metrics, but when you look at that, sort of what is the target there?
Well, I think if you look at the epi curve for the state of Hawaii overall, if we had maybe fewer than 100 cases a day, so that would be less than 21, less than 700 cases per week, I think that would be something that we could probably manage with our local staff, our local hospitals, our local healthcare system, and all the other systems besides just the hospitals. Even the Department of Health, contact tracing, isolation, quarantine, testing, all of that, I think would be much more manageable. So I think that's something to look at, as well as a percent test positivity. And then also, not having all the surge staffing here, not needing the tents out in front of the hospital. I think those would all be really important things for us to keep an eye on.
If we can shift our focus now to vaccinations, and we saw a large uptick in those vaccinations being given out once the Delta really began running rampant here in Hawaii. What are you seeing now with vaccinations and those efforts? Are those numbers staying consistent, or have we seen a drop in the number of vaccinations that have been being put into arms right now?
It was interesting to see that back in mid-July, when the case count started hitting 160, 200 and started going up, we saw an uptick in the number of people being vaccinated. And then we've seen a pretty significant rise for a number of factors. We're back to doing a significant amount of about 30,000 shots per week. And that's been for the past several weeks, for the past month or so. Last week, I think we did about 41,000 shots. And we're on track this week to probably be at least 30,000 shots. So those are all really encouraging things for us. Some of them are people getting the third dose for those who are immune compromised. And it's not a huge number, but there's some of that in there. We're separating that out from when we calculate percent fully vaccinated. But we've seen the uptick. We hope it is sustained. We know there are still, 350,000 people who are not vaccinated yet. And so that's the goal, is to get as many people as we can vaccinated. That will protect our community.
We have some questions in the comments about children. We know that 20 to 25% of the daily case count, we've been told, accounts for kids, and that's a pretty wide range, 0 to 17. Can you tell us a little bit more about how the pediatric population is doing in our state right now if they contract COVID?
So we've seen as far back as July, before our case counts really started escalating, we had about 22% of the cases per day were in the pediatric population. And that's held remarkably steady even through the big spike in numbers. Across the mainland, I talked to my colleagues and we're hearing of a lot of pediatric hospitalizations and some really, really sick children. Thankfully, I'm not seeing that level of hospitalization here in our state. I'm not sure why that is, but I'm just happy that we're not seeing that many, really sick kids ending up in the hospital from COVID. That being said, nobody wants anybody's child to end up in the hospital from COVID, and the little ones aren't eligible for vaccine yet. So, we as adults and as parents and as neighbors and community, we should be getting vaccinated so that we create a bubble around those young ones who can't yet get vaccinated, and that's going to be the best way we can protect them.
Kanoi has a question here regarding boosters. She says, boosters, I'm confused now that we don't need a booster. What changed 2 months ago that boosters was needed? There seems to be some conflicting information about boosters, what is needed, what is not, when is the best time to get them. What can you tell us right now about where we're at with boosters and those who are eligible to get them?
So there's two situations here. One is a third shot for those who are severely immune compromised. And what that's all about is, after you got your 2 shots, your immune system reacted and you have a level of protection. For those who are very immune compromised, like say after an organ transplant or they take immune suppressant medication or something, or cancer chemotherapy patients, even though they got their 2 shots, they never mounted a response to get to that protective level. And so for that population, the third shot has been authorized, and we've been doing that. As far as booster shots go, for the rest of us that had protection, and we still have protection from severe illness, hospitalization, and death, but we know that your antibody levels can drift down a little bit. And so there's a conversation now about whether we should get booster shots. That's still not been approved yet, but that is the discussion. And on the 17th, the advisory committee for the FDA met, and they recommended authorization of a booster shot for those 65 and older, because especially in the older population, we know that the immunity tends to wane a little bit faster than everybody else. And also for us, the Kupuna were the first to get their shots. So they got it way back in January and early on. The FDA still needs to decide whether or not to accept that recommendation about authorizing the booster shot for those 65 and older and for those who are at high risk. After that, it goes to the CDC's advisory committee, and they're meeting today and tomorrow to discuss. So the FDA is a regulatory side and the CDC is a clinical recommendation side. So the CDC will then take that recommendation from the FDA and they will discuss whether to support that clinically. So is that a good idea? Should we do it? And should it be for those 65 and older? Are we talking about congregate living, or are we talking about just a strict age cutoff? And when we say high risk, do we mean, those in care homes or in the correctional facilities, or are we talking about first responders? So we're really waiting to see what the CDC recommendation is, if the FDA should go ahead and approve that.
One of the conversations that's happening right now is this whole debate about the crisis of care standards and whether age should be part of that. What are your thoughts on that? Are we in a position, you did say that the ICUs are holding steady, so that's not good, but the hospitalizations overall are dropping down. Are we in a place where that could be something that our doctors need to face? And what are your thoughts about including age in that calculation?
So with regards to the crisis standards of care, that was a document that was created by 21 different healthcare providers in our community last year. It actually was over a year ago. And that document was initially posted on the website for HIEMA, the Hawaii Emergency Management Association. Since then, it is a living document. And so it was reviewed again by those healthcare professionals in November of 2020, and then again in August, and then in September. And as far as I know, there hasn't really been any significant change to the content of that document. And the reason you're hearing about it from the Department of Health now is that we decided that it was actually more appropriate to post it on the DOH website than the HIEMA website. When I read through that document, I think it's amazingly well written, and you can think of it like a disaster plan. So you hope to never have to use it, but at least you have a disaster plan. So if a disaster hits, you can pull this plan out and you've got somewhere to go. It's not like at that point you're starting to make decisions and realizing that you have nothing there or that you haven't addressed certain issues. As I read it, that document specifically says that age is not to be used as an independent factor. And I think that makes sense. Additionally, if you look at our kupuna, we actually did use age to get people vaccinated early on. We gave preference to the kupuna to get vaccinated. And I think that's held us in really good stead, because if you look at the rates of hospitalization and of those who are fully vaccinated, we're not seeing severe COVID as much in our older population. That document is a disaster plan, if you will, if we get to the point where we don't have resources. And so it's not a matter of saying, well, we should do what we can to not get there, or, we should bring in more people to help. We have brought in 650 people to our state. We have set up tents. We have stopped elective surgeries. We have done everything we can to avoid that situation. And thankfully, we have avoided that situation. But I think to have that disaster plan, if you will, just makes sense. It's well written. We want it to be fair. We want the community to look at it. It's been, scrutinized by many, many people. I think it's reasonable. The one thing that seems to be getting everybody stirred up is that if there was a tie, if we were, if there are 2 or 3 people that are in the ICU that are critical condition and we don't have enough resources, then that document is a process to say, how do we decide on the limited resources, how to allocate it the best? And that's what that is. And for that, age is listed as one of the tiebreakers if everything else was equal, specifically for COVID. And that's because the research shows that for those 65 and older, the outcomes for severe COVID were worse if you were older than 65. And that's how that got in there. Several other states actually use age for a lot of other things. And I think our state, the document that was created in our state is actually pretty good on that. We really don't have age in there to the extent that other states have it. And I think that the group that wrote this was really careful about that.
With our large number that we're seeing with those who have gotten infected with COVID, a lot of it due to the Delta variant, there is some in our community that argue that those individuals who have built up a natural immunity to the disease and have survived it should somehow be included in the vaccinated population because of the fact that they have gone through the virus and they have built those natural antibodies. And in fact, I believe at one point the lieutenant governor was even asking for those people to be included in the vaccination count as well. Can you talk us through about that decision for those who have survived and have built up that natural immunity, why they are not maybe included in the vaccinated population?
So I think, even though we've been in this for a year and a half now, I think we have to realize that there's still a lot we don't know about this disease. People who had natural infection, what happens is your body gets infected and then you develop antibodies to it. How long will those antibodies be around? At what level will they remain? That remains to be seen. But we do know that when we vaccinate people, your level of antibodies goes sky high, much, much higher than what they're seeing from natural immunity. It's interesting to note also that for those who have had COVID infections, at least in some parts of the world, they're seeing reinfection when other variants show up in those countries. And we saw that early on in South America. And so we know that our vaccine right now protects against, native COVID as well as some of the other variants, the beta and the alpha variant and the gamma variant and delta variant. And so I think right now, knowing that we get so much more protection from the vaccines, it makes sense to vaccinate people where we know they'll get good levels of antibody. We know it's effective against people ending up with severe illness, hospitalization, or death. And it's protection against so many different variants.
Sticking with the topic of vaccinated individuals, Lynn's got a question here. Are vaccinated individuals less likely to spread the virus? Do people with breakthrough infections give off less of a viral load? We know that if you've been vaccinated and you do catch COVID, you're less likely to end up in the hospital. But what about your transmissibility?
So we are seeing that, again, this is being studied right now, and I don't have a crystal ball, but what we know so far is that when people who have been fully vaccinated, that you can still get infection, you can still test positive if you get bombarded with COVID. And when they do swabs, they can still pick up virus on those individuals. The thought is that for those who are fully vaccinated, that they don't shed virus for as long. So even if they were to get infected with COVID, that it's a shorter duration. And I don't know if the degree to which they're shedding virus is the same as for people who are not vaccinated. I'm sure there's some research out there, but I'm not up to date on that.
We're getting a lot of questions here about weddings and events that are not allowed right now here in the city and county of Honolulu under the current order by Mayor Blangiardi. And there seems, again, to be this disconnect and this, frustration between local residents and visitors between what is allowed and what is not. Of course, we know that there have been some luau's that have been taking place that have large gatherings, but on the other side, weddings are still deemed not able to gather and to be conducted during this time, even though there are individuals who were asked to be sort of safety monitors in those areas and follow those protocols. So what was the decision through that process of allowing maybe some of the luau's to continue to happen, but maybe not those weddings? And ultimately, I know that you're not the one that makes those decisions. You provide the recommendation, but how would you address those concerns and those questions from people who see this contrast and feel like things aren't really fair in this area?
I think we've done our best to convey that the best way that we're going to keep our spread of this disease down is to avoid indoor gatherings, to avoid any large gatherings, to wear our masks, and to get vaccinated. So, we're trying to really discourage the counties from having any sort of large gathering. If you look at the cluster reports, I think it was a few weeks ago, there actually was somebody who got sick at a wedding. A few people got sick and somebody ended up dying. I wouldn't wish that on anybody. And if we could just get vaccinated and keep the social gatherings down, if I had my way, would I say go to gatherings of 5 indoors and 10 outdoors? Probably. The more we can keep the gatherings down, the less we have large groups getting together. If we can just stay the course and sit tight for a few more weeks, I think we'll be in a really good place. So large gatherings in general, I think is a really, really bad idea. And we know from cluster reports, that's how diseases spread.
I want to ask you, it's a question that I've asked you in the past, and I just like to get an update about your own personal behavior and how you're navigating this circumstance, because it really feels, I know for me, it feels like a lot of guesswork. Do I take my kids with me to the grocery store? Do I only get groceries delivered? Can I go to a playground? Can I not? Can I eat at a restaurant? All of these sort of questions. How are you recommending that people go through their daily lives right now? How should we be behaving?
It's interesting. I think we really saw the peak of things right before the Labor Day weekend. And especially with this Delta variant, it is just so contagious. I was recommending to my family that we kind of go back to the things that we used to do before we had the vaccine. And so, wearing masks and being real careful to wash hands and not being indoors with other people and really limiting the social interactions to those immediate family members. I think now as we see the cases coming down, I think to go to the grocery store or something is reasonable. Wear your masks and make sure others around you are wearing their mask. That is going to be the number one thing. Get vaccinated. That's also going to help you, and that's going to protect you. So I think between those two, if I could give anybody any advice, it's wear your mask, especially indoors, and try and just stick to your immediate family. Go grocery shopping, that's okay, but I probably wouldn't hang out in the supermarket for an hour. Go and do your shopping and head home.
Aside from the vaccine, of course, there are treatments that are become available, like monoclonal antibodies that have been used. That there has been some questioned and some worry by some in the community that there is a large demand throughout the nation, and that we're not getting as much of the treatment as we need in order to help to supply all those here in Hawaii that need it. What can you say about the ordering process, and if the state is equipped with enough to help those who are end up in the hospital or end up getting infected?
Yeah, so we're talking about specifically the monoclonal antibodies that are used in COVID-19 infections, because there are other monoclonal antibodies for other treatments. I think if you look at the total numbers that were administered in our state the week prior, so there's two different monoclonals that we're seeing in our state for the most part. And Regeneron or RegenCov is the one that's sort of on everybody's radar. We administered about 478 doses last week. 380 of those were the RegenCov, the Regeneron. And then I think we were allocated 610 doses of that to be ordered. So we put in that order at the end of last week. So what happened is I think people started hearing about it, and it sort of ended up in everybody's consciousness. And so the wish list of, who wanted to order these medications just blew up. And so, we had requests for like 1,488 doses, but some of them are in entities that have yet to set up a program or administer the monoclonal antibodies. So I think for now we have an adequate supply. We seem to be having a decent amount, and we still have over 1,000 doses, from previous orders that's within our state in various, hospitals or clinics or whatever, FQHCs and whatnot. So we do have some in our state right now, and then we can order more on a weekly allocation. So I think we have an adequate supply right now. I think the real message is that if people were to be fully vaccinated, we wouldn't need to be using hardly any of the monoclonal antibodies, because primarily it's being used in people who become infected, and primarily in those who are not vaccinated. It's not FDA approved. It does have emergency use authorization, so it's reasonable and it's safe. It's not for everyone. It's for those people who are infected and who are at high risk for a bad outcome. So the vaccine is significantly better studied and tracked and evaluated, and we know that works. We've given billions of doses of vaccine and not nearly as much of the monoclonals. But the thought is that if you get infected, your immune system produces antibodies that protect you. Sometimes your system gets overwhelmed and you get really, really sick from it. The monoclonals, if we can give it to you early in the course when you're symptomatic and you're at high risk, but you haven't gotten severely sick yet, it's kind of like an external boost to your antibody system. And so it should hopefully tamp down the infection so that you never go on to get that sick. You never get sick enough where you need to be in the hospital. And so that's how it's being used. So again, if you get vaccinated, it's less of an issue to deal with the monoclonals.
I know we're almost out of time, but I want to bring in this question from Heidi because it's a consistent debate in our community, which is, what is your opinion on pre-travel testing for all incoming travelers? I know that in the past, it's been said that travelers only account for about 2% of the COVID cases here on the islands, but others would argue that's largely because visitors are not getting tested when they're here because they're on vacation, and so that's probably the last thing that they want to do. Do you think that Safe Travel should reincorporate this requirement for travelers?
So the testing question is actually, it seems like it should be pretty simple, but there's a lot of complexity to it. first of all, there's a capacity issue, right? So if we had everybody test before they got here, we're talking another 30,000, 20 to 30,000 tests per day, and then we have a provision that we see local residents taking advantage of more than visitors, and that's that people are just not getting tested at all, just saying, oh, you know what, I'm just going to go into quarantine when I get home. I'll just stay home for 10 days. And so even putting that requirement on still wouldn't catch that population. They'd still be allowed to come in and just say, well, I'm just going to quarantine. I'm not going to test. So that wouldn't address that population. But additionally, it's just the volume of tests and the amount of tests that we would need. There's also been some question about what about testing everybody, after they get here on day 3 or 4. From a public health standpoint, that would be awesome to test everybody. But again, how do you track people down on day 3 and make them take a test? And then where do we find an additional 30,000 tests every single day and get that added into our system and be able to take that data and incorporate it? I think really, I'm still holding steady on travel that it's just not a good time to travel right now. And again, I think if we can sit tight for another 4 weeks or so, we'll be in a different place and we'll be in a much better place.
All right, Dr. Char, thank you so much for spending your morning here with us and taking some of our questions as well as our viewer questions. We really appreciate you coming on each month to give us a breakdown of where we're at as a state and just for all the information you provide. So thank you so much.
Thank you.
Aloha. And Yunji is muted. It will happen once a show, and there we go.
Yeah, we are out of time. I mean, we could talk to her at length, and I think we covered a lot of issues. There was a lot of questions here about weddings, and I know that so many in that industry, some of them our own friends, are very frustrated with these restrictions. Dr. Char really holding steady, saying, look, 4 more weeks of these gatherings, and she would even perhaps advocate for going down to 10 outdoors and 5 indoors to really clamp down. Because she did note that while the case counts are going down, deaths are holding steady and ICU capacity is holding steady. And, the ICU beds in particular represent a really important part of our healthcare system. And we've got to get those numbers down.
And she's also saying that we are continuing to see that number of those getting vaccinated or deciding to get vaccinated continuing to stay higher than they previously were, and that one of the other issues that has recently come up with these monoclonal antibodies, and there was some fear out there that we may not be getting the full amount that we needed. Dr. Char reassuring us that a large part of the reason why we're not getting that volume is because of demand that went up when people found out that there might be this shortage. But we do have more than enough right now that we are currently giving out, but also noting in her context saying that getting vaccinated is still much safer than just the overall treatment that they are providing.
Yeah, some good news also when it comes to kids. She said that unlike some places on the mainland where they're seeing a lot of kids ending up in the hospital, kids here in our community seem to be doing fairly well. They do still represent that, 20 to 25% of the cases that you see every day. So that is not insignificant, but so far their outcomes seem to be okay. So that's good news there. Basically, we're not out of the woods when it comes to Delta. Things are getting better, but they're not where they should be. She praised the mayor for keeping his restrictions in place. Another person we're going to be talking to about restrictions on Friday right here is Maui Mayor Mike Victorino. They implemented their Safer Outside program, which is vaccine verification for a lot of establishments. And if you can't verify that, then you have to eat outside or take your food to go. We'll be talking to him about that and also the stress on the healthcare system over there.
Yeah, a lot happening on the Valley Isle, and it's great to get a perspective as to what's happening on our neighbor islands to figure out how they're dealing with all of this. So we're looking forward to that conversation with the mayor. Thank you so much for being a part of this conversation this morning. We'll see you right back here on Friday for another episode of Spotlight Hawaii. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.